At Cryos, our sperm donors are between 18 to 45 years old. Many of them are students, have an academic degree, or are skilled workers. Cryos sperm donors are financially and altruistically motivated. Because many are students, there's a financial motivation for donating, but mostly they have chosen to become a donor because they wish to help others who are not able to have children of their own. So for our donors, the altruistic factor tends to be the most important one. A study has shown that many of the donors also donate blood, for example, which indicates their true altruistic nature. Most are driven by the fact that they know people in their family or in their circle of friends who are reproductively challenged, and therefore understand the struggle that they go through. The motivation for donating sometimes results from experiencing the joy of having children of their own. Donors understand that children are a huge gift and wish for others to be able to experience this. When the potential sperm donor candidate sends his online application, it is received and evaluated by Cryos staff, who are trained to determine eligibility. The evaluation and approval of the initial application is based primarily on medical history and risk factors. The application who meets the initial requirements are invited in to provide a sperm sample for a quality assessment. Depending on the initial sperm quality, additional samples are occasionally required from the donor candidate to determine if they'll be invited to continue in the application process. First, Cryos tests the sperm quality of donor candidates. The sperm quality is based on the concentration and the motility. Motility is the degree of movement of sperm. The concentration of motile sperm is the most important parameter when it comes to donors. After the sperm quality has been approved, the donor candidates attend a medical examination. In all cases, the medical exam includes a medical history, risk evaluation questionnaire, infectious disease testing, and screening for genetic and sexually transmitted diseases. The screening, testing, and exams are used to eliminate candidates with high-risk behaviors and family history of significant hereditary, mental, and physical diseases. Roughly 10% pass our screening process and become a Cryos sperm donor. In addition to screening and testing of our donors, there's a 6-month quarantine on donor sperm. This allows us to confirm that there's no disease or potential hazard to the recipient. Cryos operates with different standards for a release of a donor because countries have different regulations regarding selection, screening, and approval of donors. A donor can be released according to one of several standards. For home insemination outside the US, you can use any standard. In the US, the FDA and/or New York State standard must be met. For treatment at a fertility clinic, you should use the relevant standard for the country that you're being treated in. So for example, if you have treatment at a clinic in the UK, you need to choose the UK standard in the search criteria under donor search. The donor sperm undergoes multiple ID checks at various points throughout the processing and freezing of the donor sperm process. Furthermore, Cryos sperm donors undergo a verification process every time they donate a sperm sample, ensuring identification. It is important for Cryos International to ensure high standards of quality and safety regarding our sperm donors.